Have you ever looked at the hair in your shower drain and wondered, is this normal? Is this just me getting older, or is my body trying to send me a message? Well, today we're going to decode what your hair loss might really be trying to tell you about your health. Right, let's just get into it, because that thinning hair could be way more than just a cosmetic thing. It might actually be a critical clue about what's going on inside your body. We're going to break down what your hair is really saying. First up, we're going to look at those cases where your own body is the culprit. You know when your immune system kind of gets its wires crossed? Or when a huge shock to your system suddenly shows up months later, right on your scalp. So you've probably heard of alopecia areata, right? It's the condition Jada Pinkett Smith has been so open about. And it's way more common than you'd think, affecting about 1 in every 50 people. Basically, your own immune system gets confused and starts attacking your hair follicles, which is what causes those classic round, totally smooth patches of hair loss. But in some cases, it can be, well, a lot more dramatic. Just look at this. This 33-year-old man literally went completely bald almost overnight from a really severe form of it. So doctors put him on high-dose prednisone, which is a powerful steroid that basically tells your overactive immune system to just chill out. And the results? They were absolutely incredible. In just 6 months, he had a full head of hair again. Another autoimmune troublemaker is lupus, but it gets a little tricky because there are different kinds. You've got discoid lupus, which is what the musician Seal has. It affects the skin and can cause scarring and even permanent hair loss. Then there's systemic lupus, which Selena Gomez has talked about. That's different. It affects your internal organs. Okay, so have you ever gone through something super stressful, like a nasty illness, a major surgery, or even a crash diet, and then a few months later you notice your hair is shedding like crazy? Yeah, that's probably telogen effluvium. It's like a major shock to your body is a fire drill for your hair follicles. A whole bunch of them get the signal to evacuate all at once, and a few months later you see the result in your hairbrush. But the good news here? It's almost always temporary. Once the drill is over, things usually go back to normal. So how do doctors even check for this? Well, there's a surprisingly simple test, and you can actually try a version of it yourself. It's called the hair pull test. You just grab about 50 or 60 hairs between your fingers and give a gentle tug. If like 1 or 2 come out, it's no big deal. But if more than 10%, so we're talking 6 or more hairs, come out, that's considered a positive test. It's a sign of active shedding. Sometimes the shock isn't from inside your body, but it's a direct assault from the outside. This 41-year-old woman had a really severe allergic reaction right after dyeing her hair. Her scalp got super itchy, her face swelled up, and then over the next 4 months, she lost almost all of her hair. It turns out she was extremely allergic to a chemical called PPD, which is in a ton of permanent hair dyes. Thankfully, with some steroid treatment, she made a full recovery. It's a crazy story. Now, here's where things get interesting. Sometimes the pattern of the hair loss is the biggest clue. Take a look at this. This patchy, kind of moth-eaten look is a very, very specific sign that can point to a sexually transmitted infection that's actually been making a comeback: syphilis. And this quote just says it all. Syphilis is known as the great pretender for a reason. Its symptoms can be all over the place, and they can easily be mistaken for other illnesses. The good news, of course, is that it's totally curable with antibiotics, and once it's treated, the hair grows right back. All right, let's move on. We've talked about your immune system and outside shocks. Now we're going to look at what happens when the problem is an imbalance from within, like a major nutritional deficiency. Okay, this one is pretty wild. A true biotin deficiency is actually super rare in most healthy people. But there is one weird way you can cause one: by eating a ton of raw egg whites. See, they have this protein that literally grabs onto biotin and stops your body from absorbing it. So yeah, maybe think twice about those raw egg smoothies. Just cook your eggs and you'll be totally fine. So here's the key takeaway. Popping biotin pills probably won't do much if you're not actually deficient. But for those who are, it's a total game changer. This little 3-year-old boy had a rare genetic condition where his body just couldn't use biotin. He had thinning hair, a rash, and even problems with his speech and movement. But after just 6 weeks of high-dose biotin, he had a full head of hair, the rash was gone, and he was walking and talking. Amazing! Iron deficiency is another huge one, especially for women. This patient had really heavy periods, which left her exhausted, out of breath, and her hair was thinning out. When they did a blood test, her hemoglobin was a shocking 4.8. It should be over 12. After a blood transfusion and some IV iron, not only did her hair grow back, she told her doctor she felt better than she had in years. But here's the thing with medicine. Sometimes it's not just one culprit. You get a double whammy. And that was exactly what happened to a 28-year-old woman whose hair loss was caused by two connected issues, an underactive thyroid and a zinc deficiency. And this is where the medical detective work gets really cool. Her doctors figured out that your body actually needs thyroid hormone to properly absorb zinc from the food you eat. So her low thyroid levels were directly causing her zinc levels to drop. It's a perfect example of how interconnected everything is. Once they treated both conditions, she made a full recovery. Okay, for our last section, let's get into the most common types of hair loss out there, and more importantly, what your game plan should be. Let's start with a really big number, 40%. Look, hair loss is not just a guy thing. A staggering 40% of women will experience female pattern hair loss by the time they hit 50. Now, for women, it typically shows up differently. It's more of a progressive thinning, usually right on the top of the head, not so much the receding hairline that you see in men. And while it's often just genetic, it can sometimes be a sign of other conditions like polycystic ovarian syndrome or PCOS, which messes with your hormones. And hey, for the guys watching, we have to bust a huge myth. You've probably heard that male pattern baldness comes from your mom's side of the family, right? Well, it's not true. The latest science shows the genes for hair loss actually come from both sides of your family, so you can officially stop blaming your mom. Now, this is a really important one, so heads up. Several studies have found a link between male pattern hair loss that starts before you're 40 and a higher risk of heart disease down the road. You can't change your genes, of course, but you can see it as a pretty good reminder to really focus on the risk factors you can control, like your diet, getting exercise, and not smoking. And finally, there's a type of hair loss that is 100% preventable: traction alopecia. This is just caused by anything that pulls on your hair too tightly for too long. We're talking tight ponytails, braids, weaves. If you're noticing some thinning right around your hairline, it might just be a sign to switch up your hairstyle. Let your hair down a bit. So, what's the bottom line here? What's your game plan? It's simple. If you're worried, pay attention to any other symptoms you might be having. They could be connected. Take some pictures to track how things are changing over time. And really, the most important thing is to see your doctor to figure out what's actually going on. Because for almost all of these things, catching it and treating it early is so much more effective. Because at the end of the day, your hair isn't just there to look good. Think of it more like a check engine light for your overall health. So the real question is, your hair's talking? Are you listening?